First, I must establish scene safety, meaning that there's no dangers coming from around and there's no danger for the patient to fall or hurt himself further in any other way. Once I've determined the scene safety, then I can begin to assess responsiveness. It will also help to have the patient on a firm surface. So to assess responsiveness, I need to have tactile and verbal stimuli. So for an adult, I will tap him vigorously on the shoulders while asking if he's okay. Hey, are you okay? Are you okay? I'm trying to get a response out of the patient to see if he's really in cardiac arrest. If there's no response, I'll consider him unresponsive and recognize that he needs medical help. At this point, I will call somebody to ask for medical help. Can you please get help and get me an AED? An AED is an automated external defibrillator. This is a machine that can deliver a shock to the patient's heart. In adults, it can help in an event of cardiac arrest. They have them in hospitals, but now they have them as devices where it can analyze by itself, and even lay rescuers can use them if they're trained. So now that I have someone getting help, I go back to assess the victim again. I need to assess his pulse and his breathing. I will check pulse at the carotid artery, which is the artery that comes down through the neck, right about here. So I'll feel his carotid pulse with 2 fingers. At the same time, I will scan his chest to see if there's any chest rise, which would indicate that he's breathing. I'll do these simultaneously. It should be done for about 5 to 10 seconds at the same time. It's best to count out loud so that you get your timing correctly. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. If I don't definitely feel a pulse and see breathing within the 5 to 10 seconds, then I know that I must begin CPR. In order to begin CPR, I need to put the heel of my hand over the breastbone of the patient, which is about in between the nipples. So the heel of my hand will go over the breastbone, and the heel of my other hand will go over the heel of the hand below. Then I will bring my shoulders up directly above the patient's center of the chest, which would mean that my arms are now 90 degrees directly down into the patient. My elbows should be locked, my shoulders should be locked, and the motion should come from my lower back. So my entire upper body is one unit, and I'll need to push down into the chest, like this. 1, 2, 3. So I need to push down into the chest for 30 times before I give 2 breaths. So, 5, 6, 7, 8. The rate should be 100 to 120 beats per minute. 25, 26, 27, 28, 29, 30. When I've done my 30 compressions, I'm going to move to giving breaths. So, in order to give breaths, first I must open the patient's airway. If you'll notice, the patient's airway from the mouth going down into the lungs is L-shaped at the moment. In order to be able to give breaths, I need to straighten that airway out. We do this with a head tilt chin lift maneuver. In order to do the head tilt chin lift maneuver, I take the bottom of my hand and place that on the patient's forehead and put a little downward pressure. As you can see, the head begins to tilt. Now I take 2 fingers of the other hand and hook that underneath the patient's chin and lift it. So that is a head tilt chin lift maneuver. And as you can see, the patient's airway is now much more straight than earlier. So while I'm in my head tilt chin lift maneuver, I will open the patient's mouth, and I need to form a complete seal between my mouth and the patient's mouth. Additionally, I will have to pinch the patient's nose so that the air doesn't escape from the mouth when I blow into it. So for this hand, I'm pushing the patient down, doing a head tilt, and also pinching the patient's nose. With this hand, I'm using 2 fingers to do a chin lift, and my thumb is opening the mouth to give me access. Then I'll form a complete seal between my mouth and the mouth of the patient, and I'll give 2 breaths over 1 second, with 1 second in between to allow the air to escape, as so. While I'm giving the breaths, I'm also looking at the chest to see if the chest is rising. If the chest is rising, that means I've given an adequate breath. After I give the 2 breaths, I go back to the chest, do chest compressions. Again, we do 30 compressions and 2 breaths. And I'll do this 5 times before I want to reassess the patient. So I'll just show you one cycle. I'll start with compressions. 1, 2, 3, 4, 5, 6, 7, 8, 25, 26, 27, 28, 29, 30. So again, I'll repeat that for 5 cycles, and that will be approximately 2 minutes before reassessment. For reassessment, it will be the same. 5 seconds, 5 to 10 seconds at the carotid pulse while scanning the chest for breathing. If, when I reassess the patient, I notice that there is already a pulse, then we have return of spontaneous circulation, which means the patient's heart is already beating on its own. So I also want to be checking the chest for breathing. If I have a pulse but no breathing, that means the patient no longer needs the chest compressions, but he still needs to be supported with rescue breathing. So in order to do that, if I make sure that there's a pulse, then I'll give 1 breath every 6 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. Again, I'll do this for 2 minutes before reassessing again the pulse and the breathing. If I reassess and there is pulse and there is breathing, then I know that the patient's heart and lungs are already working. I will put the patient in recovery position, which is to lie the patient on its side. Legs will be crossed over, and just make sure the head is supported. And that's the recovery position that I can have him in until emergency personnel arrives.